Hello viewers, welcome to one more edition of ICare Positive Life series. Today, our focus is on the eye. With innovations in technology, the medical sector has seen significant changes. So is the case with ICare. Today, we have come to meet Dr. Saurabh Choudhry, CEO of ICare Hospitals, Noida. We'll try to know from him about Lasik, how it is different from other and how it has enhanced life. Over to Dr. Choudhry. Doctor, thank you for your time. I know that you are extremely busy and the situation is such that it's very difficult to allocate time. I thank you on behalf of my viewers for giving us some time.
Most welcome. Most welcome.
Doctor, if you look at it, there has been significant technological innovations which has come into healthcare, and ICare is no exception. And you are a professional who knows Lasik in and out. So my first question to you is, what is Lasik surgery and how is it any different from any other eye surgeries?
So Lasik is a procedure in which a laser is used to reshape the corneal surface. By reshaping the corneal surface, we can get rid of glasses. So why do one wear glasses? Is because the light is not focusing onto the retina, but in front of it or behind it. Once we reshape the cornea, we change its focal length and the light can then focus onto the retina and you don't need glasses for it. So primarily, it's a laser which is used, and some doctors push it as a laser and they don't call it a surgery at all. Okay. But it is not true because you are cutting some surfaces before you apply the laser. So it is not true that it's just a pure laser. It is a surgery because you are cutting you're raising up a flap by cutting it.
Right.
The flap can be raised up either by a blade or it can be a bladeless procedure as well. But the flap has to be raised up. When we call it a bladeless procedure, it's a second machine, which is again a different laser which is used to create that flap and raise it up.
Doctor, the way you explained initially, it sounded like pure basic physics, but then you really clarified that why it is a surgery. Now, are there any specific eye conditions in which this particular approach is more effective?
So, I'll say primarily it is a cosmetic procedure. When I say it's a cosmetic procedure, it means that somebody who is wearing glasses, does not want to wear glasses, is an eligible candidate for it. I won't call them as patients because patient is somebody who is suffering from a disease. And I won't quantify myopia, that is minus power glasses, or a hypermetropia, which is plus power glasses, as a disease. Because studies have shown that almost 40% of the patients do have a small amount of myopia in their eyes. Now, if a candidate is coming and he wants to get rid of these glasses, we need to actually screen the patient very well, this person very well. When we say we need to screen him, there are times that patients where the -2 come down to me and I say, sorry, we should not be doing a LASIK for you. There are others with -10 and still we go ahead and do it for them. So it all depends on the curvature of the eye, the thickness of the cornea. There are about 16 parameters which we need to see before we actually finalize a patient as a fit candidate for a LASIK procedure.
So even if you are referring to it as cosmetic, it is not so cosmetic that anybody and everybody can have that procedure done.
As I said, when I refer to it as cosmetic, it means that somebody who does not want to wear glasses, we can get rid of it. And when I do say that it is not fit for everybody, it means that it's a very safe procedure. It's a great procedure, but if done on the right candidates. Right. We do come to hear about that some patients are not doing so well, some patients, the number comes back. All this is because the initial screening criteria were not adhered to, or maybe if they were adhered to, the protocols, let's say 5 years back, were very different from what they are right now. So over a period of time, our protocols have become stricter. So if we are adhering to the protocols, the chances of anything going wrong are minimal.
Doctor, in fact, you had actually responded to my next question, which was related to success rate of this kind of surgery.
Right. Before I answer this, I'll just finish my earlier one as well. I said primarily as a cosmetic procedure, but there are some patients who do require a LASIK if, for example, if one patient has a very high number in one eye and the other eye has a normal number, then he can't wear glasses, because wearing glasses, there will be an imbalance, plus he'll be seeing two images.
Right.
Because one, if it's a high number, it'll minify or magnify,
Right.
and the other eye will be a normal size image. Right. So he'll start seeing two. So those are the indications which we reserve, and we say it is done for medical reasons.
Right.
Right. Maybe some patient does not have after a trauma, he doesn't have a lens inside the eye. We can do a Lasik for that patient as well. Now coming down to the success rate. So if done on the right candidates, it's almost, I say almost 100% success. So my patients ask me, what are the risk factors? What are the percentage of things going wrong? So that's a question. What is the percentage chances? My reply to them usually is that you're flying from Delhi to Bombay. What are the chances that the flight might crash?
Okay.
Now, if you ask the pilot, he'll say, it's absurd, it won't, it doesn't happen. So if my patients ask me, I said, it usually doesn't happen, but it's been reported. Right. So we do have some reports which there are complications. It's like crossing the road.
Right.
What is the chance that a car might hit you? It's 1 in millions, but there is a chance. So we also are very careful with the procedures. We are very careful with our machineries. There is a micro environment which is maintained inside the operation theater all the time. The machine has a backup which has another backup to it. So there is a UPS which is another UPS is feeding it. Dehumidification is happening 24 hours a day. The air conditioners are working 24 hours a day in spite of the fact it's winter or summers. We have to maintain a particular temperature. So that's what.
Doctor, you have actually identified the two aspects of remissions happening. One is a screening going wrong, or maybe not a perfect screening for a candidate. The other would be related to that individual who has gone through a procedure. So would you like to highlight on the kind of precautions that an individual needs to take?
So the precautions right after the procedure, we list them out and we give them to the patients. But a month after the procedure, we tell them the patients that you're perfectly all right. Okay. There are no precautions that need to be taken. Right. Do your daily activities, do everything. The only thing which I might tell my patients never to do is no contact sports. Boxing, wrestling, so no direct injury to the eye. Right. So that's what we ask the patients to avoid. Otherwise, on the long term, there are no precautions that need to be taken. Right. For a short period after the procedure, there are a few precautions. They can't splash water inside their eye. They can't rub their eyes. From the very next day onwards, they can get back to their daily schedules. They can sit on the computers from the next day onwards, read, watch TV, go to a movie theater. So injury also involves, if they're riding a bike, I tell them avoid riding a bike directly, but if they're riding it, visor on the helmets and a protective glass inside. So that's about it. That's what I...
Doctor, laser, usage of laser, doing this particular specific treatment requires speciality. So would you like to highlight on the kind of speciality our doctors have in the current context in India?
Right. So let me put it down this way, that the eye, though is a very small organ, but it is very, very highly specific there are different parts of the eye, and there are about 8 subspecialties in ophthalmology in the eyes as well. So there are some who are cornea specialists, there are others who are retina specialists, uvea, squint. So as a general ophthalmologist, as a general doctor, each doctor can do everything. So he's a jack of all trades but master of none. But like we in the hospital, and we've been able to make different departments, and each of us is a super specialist in our own fields. So I'm a cornea specialist, and I also do the refractive surgeries. I did my fellowship in cornea, and then I proceeded on to do refractive surgery, which is closely related to the cornea. In India, quite a few refractive surgeons are specialists, the cornea specialists. There are few who are general ophthalmologists and who've learned over a period of time how to do refractive surgeries. And so refractive surgery doing a surgery is not a big art, in the sense that it's more of technology which is guiding it. It's more of management of the patients later on. But it's not a big sort of a thing even for a general ophthalmologist to be doing a Lasik.
But from the viewer's point of view, I mean, let me pose this question, that it is always better to go to an institution which would have a bunch of doctors who would have their specialities and create a wholesome kind of a treatment.
Exactly. Patients do come down to us, and the first time the patient visits any of us is we are posing as general ophthalmologists. So when I see a patient and I see a hole in the retina, as a general ophthalmologist, I see it. Now, I've been trained to do retina a little bit, but I don't, because there is somebody in our setup who's doing a better job. So I send him to the vitreoretinal specialist who will do a better job than me. Maybe before I joined the hospital, when I did see such a patient, I used to go ahead and laser the patient up and seal the hole in the retina. But it's just that somebody who's doing that inside out, and similarly, the retina specialist, patient might land up just for glasses for her, and the patient might have a small corneal thinning, he'll be referred down to me. So it's just that, it's not that the other doctor can't do anything, but it's that being specialists, we do a better job than a general ophthalmologist can do.
Doctor, need a piece of advice from you. If somebody is looking at Lasik and he needs to go somewhere, are there any thumb rule guides that he needs to look into before, I'm not even talking about money, I'm talking about, relying on that institution in terms of the service?
I mean to say, any institution which is churning out good numbers, any center which is churning out good numbers, would do a better job than somebody who's doing few procedures. I would say, and similarly, there are a lot of recommendations which come up, your peers, others who've got it done, you hear about it, it's happening, and then I'll put it down differently, which covers not only LASIK, ophthalmology, but any medical field. For example, I've got a headache. I might land up with the doctor, he might give me one particular medication. I don't have that medication and land up with a second doctor, maybe in the same institution, maybe somewhere else, he might give me a different medications. I can always question why this and why not that and things. But biology, science, medicine is not like a thumb of a rule. Each person is different. I, as a doctor, is different. My thought process is different. I might want to treat somebody differently. A patient, maybe after 2 days, I'm seeing similar patient, similar complaints, but I might want to treat him differently. So there is it's not like 1 + 1 = 2 like other sciences. Every person is different, every doctor is different, the patient is different. It is very varied treatment over a period of time, and patients do fairly well with everything. So coming back to it, there is no thumb rule that, okay, this has to be done in this patient and this is the only way to do it.
So, Doctor, coming down again from the viewer's perspective, what are the kind of costs involved in this?
It varies from center to center, but when I will talk about the costs, it's more of a broad spectrum which I'll be talking about. The other thing also we need to be aware about is that there are, let's say, the latest machines which are available, which are slightly better than the earlier generation machines. So broadly, we call them as 6th generation LASIK machines which are available. For example, we had a machine and it was working very well. But about 2 years back, we bought a newer machine because it was better than the machine which was there. The technology did change a little bit. Now, the machine costs are also humongous. Like it's about a 3 CR investment into the machine. Now, the older machine wasn't put into the dump. So the company bought it back. They gave us a new machine, but they bought the machine back. And they won't have thrown it because it's a good working. So they would have sold it off to another doctor at a lower rate. That doctor who's got older technology will be able to perform the surgery in smaller amounts than those centers which have the latest generation and latest machines. So we do here, if you look in the market, it starts at somewhere 15,000 rupees for a LASIK surgery. It can go up to 50,000 rupees for the LASIK surgery. Different, as
is the technology and the machine.
The technology and the machine, and so like we upgraded into a newer machine. We disposed of our older machine. That machine would have landed up with another doctor. Maybe not in the cities, maybe in a town, maybe in a smaller B grade town. But so the costs But standardized cost for a simple LASIK procedure is about 40,000 rupees for both the eyes. And if we're talking about a bladeless procedure, it's almost double. It's about 80 to 85,000 rupees for both the eyes.
Okay.
So that's just a rough sort of a thing, which is with the latest machines, and which I would suggest is a better way to go about it. So somebody says, oh, I got it done for 15 or 20,000 rupees, I'm doing very well. So it's not that you're not doing very well, but the chances of things going out of the normal are slightly more with the older generation machines as compared to the.
Doctor, at this point, I would like to pick on a few words that you said till now. Cosmetic, people are not interested in using glasses. Given the whole fashion orientation with people today, so basis these, I would like to ask you, do you see any specific profile of people who are more attuned to coming in for this kind of a treatment?
I do see, so there are basically two broad categories. One, I'll put it down as three broad categories. One, in India especially, the girls who haven't got married, wanted to get married, and because of the social attributed to it, there are quite a big chunk are those girls who are wanting to get married. Then there is this group who are wanting to get jobs into specific profiles, who because of the glasses are not eligible, and once they get the procedures done, they are eligible, or there might be a few who are still not eligible because they've got the procedure done, but still want to take a chance that once they go for their medicals before they get their jobs, they might miss it out. So miss out that the LASIK has been done. So that's the second group. And the third group is a different profile of patients who are more of socialites and who just don't want to wear glasses, more for cosmetic purposes.
Right. Doctor, are there any specific centers? I mean, we have seen there are specific pockets in India which is developing for various treatments. So from that point of view, do you find certain pockets in India where LASIK is growing? I mean, I would really feel that Bombay would be a huge center given the film industry out there. So going forward, do you see any specific pockets?
Not really, but let's say 4 years back, 3 years back, there were very few LASIK machines in towns. It was only city-centric. Right. So Delhi had a few, Bombay had a few, Chennai, Bangalore, Calcutta. But now it's that like anything else, the medical services in these towns is improving. Similarly, the ophthalmology services in these towns are improving, and there are quite a few LASIK machines which now people are putting up in these towns, because there's this potential of the first category which I did tell about, these girls who wanting to get married. Right. So there's a big potential for business there.
Doctor, thank you for your time, but before we sign off, I would really request you to spare a few words for our viewers in terms of what they need to do to take care of their eyes.
Right, so I would just put it down broadly. It is besides the LASIK point that yes, I do see quite a few patients when they come in. The first point of contact for them is the chemist. So they're self-treating, or a non-doctor is treating them. I would advise never get a over-the-counter drug for the eyes. So a redness in the eyes could be just a mild redness because of mild infection. It could be something else. It could be so it could just be conjunctivitis. It could be something like a glaucoma, which could be causing a red eye. It could be uveitis, which is an inflammation from inside the eye. So I have actually seen a patient with a small infection in the eye, was given a steroid drop which he took, and we had to actually ultimately take the eye out. So it was just because he just went and this was one thing which I'd like to put it down. The other thing what I would like to say is never splash water inside the eye. So there's this big subgroup of patients who come and who say, my eyes are very healthy. In the morning I get up and I clean my eyes well. I splash water inside my eyes. The same patients who might have been coming down to me about 10 years back, 7 years back, I would have said, yes, good, keep on doing it. But over a period of time, there have been quite a few studies, and we've realized that the eye has its own microenvironment. So for viewers' sakes, I like to tell them that there are tears inside the eye. Right. We keep on producing tears, and they drain out from back into our throat, and we don't even realize it. So as children, when we used to cry, sometimes we've tasted the tears. They're very salty. So there's a different microenvironment in our eye. When we're washing or splashing water, we're actually disturbing the normal microenvironment of the eye.
Right.
This can lead to dry eyes later on. This can lead to other problems later on because there are some lubricating eye drops which I now prescribe my patients. They say, why lubricating eye drops? Why do I need a medication? I say, you actually don't need it, but whenever you're uncomfortable, you can use them because they've got the same composition as that of a tears, rather than splashing water. So over the counter, don't splash water inside the eye. Anybody above the age of 40 should at least get a baseline eye checkup done because there are quite a few diseases like glaucoma, like age-related macular degeneration. If they're caught in time, if caught early, then they can be prevented from progressing. Now, glaucoma is a disease, kala motia, it's called thief of sight. Why kala? Because it's like a kala chore. It just steals away the vision without the patient realizing it. So there are times patients land up to the clinics, to the hospitals. They say that we've got a problem and we say, sorry, we can't do anything about it. It's just that because the glaucoma was not caught early, it wasn't treated early, and it's now come to a stage and it is an irreversible change. So after the age of 40, a baseline screening test with the retinal examination is a must. And if there is a family history, once every 2 years thereafter, the eyes should be checked by an eye specialist. That's what I would.
Doctor, thank you so much for your time. We really appreciate the feedback you gave us, and we look forward to more such interactions in the future.
Thank you. Thank you. Thanks a lot.
Thank you.